Hello, this is Laura Kelly, and this is my presentation for the Health Insurance Portability and Accountability Act, an overview and analysis. That's the what I had chosen, and this is for Nursing 273, Healthcare Regulation and Finance. A brief history of HIPAA. The Health Insurance Portability and Accountability Act was enacted by the U.S. Congress in 1996. The primary goal of making it easier for people to keep health insurance, protect the confidentiality and security of healthcare information, and help the healthcare industry control administrative costs. Um, HIPAA is divided into two main sections. Title One, which protects health insurance coverage for individuals who lose or change jobs and prohibits group health plans from denying coverage to individuals with specific diseases and pre-existing conditions. And Title Two, also known as the Administrative Simplification Provisions, which requires the establishment of national standards for electronic healthcare transactions, national identifiers for providers and health insurance plans and employers. Um, the mission of HIPAA, the main mission of HIPAA is to improve portability and continuity of health insurance coverage in the group and individual markets, preventing fraud, abuse, health insurance, and healthcare delivery. They also have set it up to promote the use of medical savings accounts, improve access to long term care, services and coverage, and simplify the administration of health insurance. But the importance of HIPAA in healthcare, it plays a crucial role in healthcare by it does protect the patient health information. It sets the standard for protecting sensitive patient data and any company that deals with PHI, which is protected health information. They must ensure that all required physical, network, and process security measures are in place. Um, Compliance measure ensures the confidentiality, integrity, and availability of PHI and provides individuals with rights over their health information, including rights to examine and obtain a copy of their health records and to request corrections. I have worked with United Healthcare. Um, I probably should have started that in this presentation. I worked with them for 10 years. And so PHI and HIPAA was pretty crucial when I worked telehealth. Uh, they were extremely, it was important in that line of work. Um, so, the role of HIPAA in regulating healthcare organizations. HIPAA plays a significant role in regulating healthcare organizations by setting standards for us for the handling and exchange of PHI. It does ensure that healthcare organizations implement necessary safeguards to protect, whether it's stored or transmitted electronically. That's all we had done was everything was completely online with UHC. HIPAA also regulates the use of PHI, limiting the circumstances under which it can be disclosed without patient consent. And that was also a very crucial part of my role. Importance of compliance for healthcare organizations. Compliance with HIPAA is crucial for healthcare organizations. Noncompliance can result severe penalties, including fines, criminal charges, and more importantly, HIPAA is a critical aspect of maintaining patient trust. Patients need to be confident that their personal and sensitive health information is being handled securely and responsibly. An example of this was during that COVID pandemic, the use of telehealth services have surged. We used this actually even in the med spa setting, doing assessments. And so maintaining HIPAA compliance in those virtual interactions was paramount. Protection of public health, protecting patient privacy. One of the primary ways HIPAA protects public health is by safeguarding patient privacy. It sets standards for handling and exchange of PHI, ensuring that healthcare organizations implement necessary safeguards to protect the privacy. This includes limiting the circumstances in which PHI can be disclosed without patient consent. By protecting patient privacy, HIPAA helps to maintain patient trust in the healthcare system and encourages individuals to seek necessary care without fear that their personal information will be misused. I think that's an important step that our patients and our clients feel like, they know that their information is going to be with them, and they decide that. Importance in the digital age. The importance of HIPAA's role in protecting patient privacy has become even more pronounced in the digital age. Uh, Recently, in one of my clinics that I worked at, we had gone from paper over to digital, and that was quite the chore. But it was really important how we went about doing even utilizing that paper as well. With the rise of telemedicine, digital health records, there are more opportunities than ever for PHI to be compromised. HIPAA has adapted to these changes, providing guidelines for the secure transmission and storage of electronic PHI. For instance, also, like we talked about, the telehealth services have surged. Um, Data security. Another crucial way that HIPAA protects public health is by ensuring that patient data. Uh, HIPAA sets forth standards for securing, handling, storing, and transmission of PHI. This includes both administrative safeguards, such as policies and procedures to manage the selection, development, and implementation of maintenance of security measures. How we stored our information, digital information, was crucial as well, such as access controls, audit integrity, and transmission security. The importance in the digital age. With the rise of digital health records and telemedicine, again, ensuring the security of PHI has become increasingly important, of course. It does requiring covered entities to ensure the confidentiality, integrity, and availability of all. Um, Case study, again, with telehealth services surged, it was extremely important maintaining HIPAA compliance. Um, in these virtual interactions, it was paramount. Despite the relaxation of some enforcement measure to facilitate the transition to telehealth, healthcare providers were still encouraged to use secure HIPAA compliant technologies, whether that was like through secure email. It was just like in the beginning of calls was just crucial. And so data portability, that's also extremely important when it comes to HIPAA. It plays a crucial role in public health by facilitating data portability. Patients have the right to access and obtain a copy of their health information. It can be transferred to another healthcare provider if needed, which is actually um, extremely convenient for passing that information when it's signed off. It ensures continuity of care when the patient switches provider or needs a consult or a specialist. Importance: the rise of digital health records has made portability even more important. EHRs, or electronic health records. Patients' health information can be easily and securely transferred between health providers again, and improving coordination of care. Also, a medication, reducing likelihood of medical errors. So, I do have a case study listed here that I had found: the Cancer Genome Atlas TCGA program, which collected clinical and molecular profiles of more than 11,000 human tumors across 30 different cancer types, is an example of how HIPAA facilitates data portability. The data collected, um, standardized, and made available to researchers worldwide, enabling large scale translational research and driving high quality survival outcome analytics. And that was with 11,000 human tumors that they had studied. Um, HIPAA standards, security, another crucial standard that health systems, again, must meet for compliance. This rule establishes national standards to protect individuals' information, PHI, personal health information that is created, received, used, or maintained by a covered entity. The security rule requires covered entities to ensure the confidentiality, integrity, and availability. It includes implementing appropriate, like administrative, physical, technical safeguards. Administrative safeguards, we involve actions, policies, procedures, of course, to manage the selection, development, implementation, and maintenance of security measures. Again, the importance of compliance is again its security rule for essential for health system non-compliance, severe penalties, fines, potential criminal charges. More importantly, is the compliance of maintaining patient trust. And then privacy, again, it's one of the key standards that health systems must meet for compliance. This rule establishes national standards to protect individuals' medical records, other personal health information. It applies to health plans, healthcare clearinghouses, and those healthcare providers that conduct certain healthcare transactions electronically. Key provisions requires appropriate safeguards, again, protect the privacy of PHI, and sets limits and conditions on the uses and disclosures that may be made of such information with outpatient authorization. The rule also gives patients rights over their health information. And I think that's just so vitally important, including rights to examine, obtain a copy of their health records, and to request corrections. I think it's so important in this day and age that we do have that right to our health records, and our patients have that right to examine and obtain a copy. Importance of compliance. Compliance with the privacy rules crucial for health systems. Non-compliance, again, penalties, fines, criminal charges. But more importantly, with privacy is the critical aspect of maintaining patient trust. Can't stress that enough. Patients need to be confident that their personal and sensitive health information, of course, is being handled securely and responsibly. Um, Breach notification rule is another example of HIPAA standards. Um, it's a standard that health systems must meet for compliance. This rule requires covered entities and their business associates to provide notification following a breach of unsecured protected health information. A breach is generally an impermissible use or disclosure under the privacy rule that compromises the security of privacy of the PHI. Key provisions. The breach notification rule specifies what constitutes a breach, the content and method of the notification, and who must be notified. In general, the notifications must be provided without reasonable delay, and you have 60 days following the discovery of the breach. Notifications must be sent to affected individuals, everybody that is affected by the breach. And the importance, again, I can't stress enough, working with United Healthcare, severe penalties, fines, potential criminal charges, and maintaining patient trust. Patients need to be confident, again, that they'll be informed if their personal sensitive health information has been breached. They need to be notified of that. Um, Conclusion in summary of this, that the role of HIPAA, the Health Insurance Portability and Accountability Act, it does play a crucial role in the healthcare sector. It sets standards for the protection of patient health information. Um, it does ensure the privacy and security of protected health information, regulates its use and disclosure, and gives patients rights over their health information. The impact contributes to public health by protecting patient privacy again, ensuring data security, facilitating data portability. By safeguarding PHI, HIPAA helps maintain patient trust, overall patient trust. Can't stress that enough. The standards for data security and portability also improve the quality and coordination of care. It reduces the likelihood of medical errors and enable large scale translational research. Standards for compliance. Again, HIPAA sets forth several standards that health systems must meet for compliance, including the privacy rule, the security rule, and the breach notification rule. And we covered those three. Compliance with these rules is essential for avoiding, again, penalties, maintaining patient trust, ensuring the secure and responsible handling of PHI. Can't stress that enough with those things, with those three, avoiding penalties, maintaining patient trust, and privacy for our patients. Thank you. And that's the end of my presentation.